Hello, doctors. I am Dr. Garima, and in episode 2 of the OPG series, I am back with case number 2. So, without any delay, let's dive in straight to the OPG file. So, today we have case number 2, and there's a lot going on in the mandible as well as maxilla. Starting with the basics of reading an OPG file, we take a brief scan into whatever structures that are there. First, the number of teeth. As we can see, there are a few teeth that are missing in some spaces. You can see one impaction and also a few dental treatment that has been done here and there. This is a general idea. Now let's go on to the bony structures. First, you see the right side of the mandible. The condyle seems fine. Then this is the condylar coronoid process. Ramus of the mandible, body of the mandible. Now if you see here, one important finding is the inferior alveolar nerve bundle traversing this way up till the mental foramen, and it involves the mandibular molar roots. This could be an overlap, but to make sure that there is no involvement of the nerve bundle in proximation with the roots of mandibular molar, a CBCT confirmation is needed. Next up, moving to the center, we can see a few dental treatments that have been done. Posterior molars are missing on the right side. This is a crown. Then there is a root canal treatment that has been done. After this, we can see there is an old restoration over here and also on these two teeth. These are cervical restorations. That is why the appearance looks this way. And similarly on the upper teeth, here you see the maxillary tuberosity. Then moving on further, again there is an old restoration which is visible on this tooth. This white shadow is actually a filling, a restoration that has been done. Next up, moving further on the opposite left side, here we see another old restoration which has a radiolucent lining just beneath the filling material. And after this, we can see there's a case of impaction over here where the whole wisdom tooth is impacted inside and underneath the tuberous bone, the maxillary tuberosity. If I zoom it out a bit, you can also see and appreciate the maxillary sinus. This is the maxillary sinus, and here you can see the lining, the floor of the sinus. Similarly, on the right side, this is the maxillary sinus and this is the floor. So you can see on this side, the sinus floor has drooped slightly lower compared to the left side. You also see a few restorations on these teeth. These again are cervical restorations, and also on the central incisors. That is why the slightly more radio opaque appearance over here. Let's zoom it out a bit and move towards the extreme left. Another important finding over here is this radiolucency that we can see. It looks unilocular. The shape has a very well defined border. Let me zoom in for you. If here you can appreciate, following the line along, this is a very smooth line that we can see. and this whole area is radiolucent. Another important finding over here is this radiolucent line traversing lateral to medial. However, the cortical bone does not show any kind of displacement or step deformity. There is a possibility of fracture over here, even though the fragments beyond this angle do not seem to have displaced. Now, this radiolucent cyst, what it looks like, was an accidental finding and it was asymptomatic. So, only because of an OPG, we were able to identify this lesion that was existing inside the patient's mouth, which was not giving any symptom to the patient. So that's all for case number 2 today. Please stay tuned for the next case discussion. Thank you.